What is euthanasia? According to Webster's dictionary, euthanasia is the act or practice of killing or permitting the death of a hopelessly sick or injured individual in a relatively painless way for reasons of mercy. Euthanasia is also referred to as medically assisted suicide. I believe euthanasia should be an option at the end of life. People can have a do not resuscitate order, which means they do not want any life-saving treatment if their heart were to stop. This order also allows them to die a natural death. They are not intentionally ending their life, but they have made the decision to pass if it is their time. My strong feelings toward euthanasia have a lot to do with the loss of my grandma in 2006 and my current career path, nursing. Although it never came down to a question of euthanasia, it was discussed within my family. My grandma was a young, independent 71-year-old. She loved life and retirement and still lived on her own. So you can assume when she was diagnosed with liver cancer in February 2006, the whole family was shocked. She was adamant from day one that she did not want to suffer and that if it was her time to go, she wanted to go peacefully. This lady felt so strongly that she did not want to suffer that she researched states that allowed euthanasia. I sat with her for hours and talked and researched this topic. At 25 years old, this is when I finally made a choice in my career path, nursing. As of right now, according to Procon.org, euthanasia is allowed in only 5 states: Vermont, California, Colorado, Oregon, and Washington D.C. Montana does allow it by court order. Hawaii's Our Care, Our Choice Act will go into effect January 1st, 2019. That leaves 43 states that consider euthanasia illegal. All 6 states and D.C. require residency. They all require terminally ill diagnosis with death expected within 6 months, and 2 oral and 1 written requests to a physician, 15 days apart, and you must be 18 years of age. In 2006, when we were looking into this, Oregon was the only state that allowed euthanasia. Famous author and activist Derek Humphrey pioneered this act. My grandma met all the requirements besides the residency. She quickly realized relocating would be difficult and time-consuming, time we did not have because they gave her 3 months to live. 3 months is not enough time to find somewhere to live, establish residency, and find a physician to agree to this. So her only option was to refuse treatment and to be put on hospice. Hospice is sometimes considered an alternative to euthanasia. The way the hospice nurse explained it to us, she would make my grandma comfortable and eliminate as much suffering as possible. That she did. I feel the last 2 months of her life were as peaceful as possible. Aside from the handful of trips to the hospital in the beginning, the vomiting and the refusing to eat and becoming weak over time. John Abraham wrote a book on the twists and turns of dying with dignity. This was very informative and helped steer my beliefs in the direction they are today. I'm sure you've heard of Dr. Jack Kevorkian. He sparked the debate in the 90s, and some may say began the right to die movement. He was known as Dr. Death. He made a machine similar to what they use for lethal injections on prisoners on death row. All the patient had to do was hit a button and the medication would self-administer. His first case was a 54-year-old woman with Alzheimer's. At the time of his assisting suicide, there were no laws in Michigan to stop him. Eventually, the state outlawed assisted suicide. Jack Kevorkian argued that he was doing what doctors were supposed to do and believed a patient did not need to be terminal, as we are all terminal, but had to be suffering. He was eventually convicted of premeditated murder and served 8 years in prison. In 1997, Dr. Quill from New York brought the debate to the Supreme Court. He lost 9-0, but he did begin the lawmaking for the right to die movement. This made the regulations such as physicians can prescribe lethal drugs but may not administer them, patients must get a second opinion, and have less than 6 months to live. Some people feel this is not the answer, and when a patient feels their life is not worth living, they should explore what can help give their life meaning at the end. I feel if a person is terminally diagnosed and only a limited time left, they should live and die the way they want, and most of all with no suffering. There are 2 cases in 2014 with the same outcome, yet different circumstances. John Realm, a man from Maryland, suffered from the debilitating disease Parkinson's. He had lost use of his hands, was unable to feed himself, could not walk unassisted, and began to fall a lot. He expressed to his doctor that he did not want to continue to suffer like this. His longtime doctor told him he agreed he shouldn't have to suffer and understood why he wanted to die, but could not legally assist him in the state of Maryland. His doctor told him the only thing he could do was refuse to eat, drink, and take his medication. Basically starve to death. He did just that. It took 9 agonizing days for his body to finally give up. I believe if a person's mind is made up and they no longer want to suffer, that the last few months of their life shouldn't be forced to. This argument is not just for the elderly. Brittany Maynard, a 29-year-old from California, received a terminally brain cancer diagnosis. After doing plenty of research on her condition, she decided to move to Oregon to end her life. She passed in November of 2014 with her family by her side. Her journey was documented on Care, Compassion, and Choices. I support euthanasia. I feel the way California's law is stated. According to procon.org, a patient must be physically and mentally capable of self-administering the aid in dying drug. I think this leaves it up to the patient 100%. What I mean by this is, according to JAMA Oncology, a total of 1,545 prescriptions were written in Oregon in the last 17 years. Only 991 patients died by using these legally prescribed medications. In conclusion, I feel if it comes down to this life or death decision, the patient has probably done their research and decided long before they were sick that this would be their last wish. I think each state should have regulations supporting terminally ill patients' right to die. Author Elaine Fowler writes about how death with dignity should be approved throughout the United States too. She too went through a personal experience with her brother that led to her strong views. I strongly believe that people have the right to choose how they live their lives. They should have the right to choose not to suffer at the end.